Hi, this is Shannon. This video is to help with our final practicum for health assessment, and this assessment is going to be for the abdomen. So you'll need a stethoscope and a measuring tape. I'm going to start by introducing myself and explaining to the patient what exactly they're going to need to do. Hi, I'm Shannon, and could you tell me your name? Hi, Mr. Sunshine. Could you also confirm your date of birth for me? Perfect. That looks like I have the right patient. So I'm not sure if you understand what we're doing today. Yes, we're doing an assessment of the abdomen. So I'm going to need you to remove your shirt. So be without any clothes from the neck to the waist, so that I can get a really good assessment of your abdomen. So I'm going to go wash my hands, and if you could just go ahead and remove your shirt while I do that. Okay, great. So I'm going to wash my hands. So, Mr. Sunshine, I'm going to start today by doing an inspection. So what I'm going to be doing is looking at your skin, which your skin looks like it's intact. I don't see any discolorations. The contour of your stomach is flat. It's not round or protrudent. Your umbilicus is midline and inverted. I don't see any distension in your abdomen. Just looking at you, I don't see any masses. Do you have any complaints about stomach pain or anything like that? No? Okay. And then if I could also have you cough, I wanted to make sure you don't have any hernias. So go ahead and elicit a cough for me. Perfect. Okay, and so I don't see any hernias. And then I'm going to just look and see if I see any pulsations noted in your abdomen. And no, I do not. Okay, so again, I don't see any masses. I don't see anything concerning on your abdomen. I do see that you don't have any complaints of pain. And it does not look like you have a hernia, and you have no complaints of having a hernia. I don't see any scars that would indicate you've had surgery on your abdomen. Okay, perfect. That sounds great. So we're going to move to the next portion of the exam, which will be that I'm going to use my stethoscope and listen to your abdomen. Okay, so I'm going to go ahead and listen to your abdomen, starting in your right lower quadrant. And I'm going to listen to all 4 of those quadrants. Perfect. Okay. And I don't, all 4 of your quadrants. And I do hear that you have bowel sounds in all of your quadrants, so that's a completely normal finding. And do you have consistent, regular bowel movements? Perfect. Like every other day? Okay, great. Okay, sounds good. And no histories of constipation. Perfect. Okay. All right, so then I'm going to listen further on your abdomen. I'm going to listen to your blood vessels in your abdomen. So I'm going to start with your abdominal aorta. And then I'm going to listen to your renal arteries and your iliac artery, which is under your umbilicus. And then I'm just going to listen to your femoral arteries here in your groin area. I'm doing that all with the bell. Perfect. And I don't hear any bruits. So absent of any bruits, and I was able to auscultate your vascular sounds in all of your arteries in your abdomen. So all of that is good. Looks like that's all a normal finding. Okay, so the next thing that I'm going to do is I'm going to do a light tapping on your abdomen. So I'm going to be listening in a different way without my stethoscope. And I'm just going to be tapping in those 4 areas again. And I do hear tympani in all 4 of those quadrants. Perfect. Okay, so the next thing I'm going to do is I'm going to determine your liver span. So what I'm going to do is a little bit more tapping on the right side of your abdomen. Perfect. So I'm going to tap down And once I hear a dull sound, I'm going to mark that, and that will be the top of your liver. And I'm going to go on down a little bit further, and right where it moves from dull to resonant, I'm going to go ahead and mark again. So just doing that, I'm able to assess that your liver is 7 centimeters, which is a normal liver for your size. Perfect. All right, and so then I'm going to go ahead and do a lighter touch, and what I'm going to do is assess you for any tenderness or any masses. And if you could just let me know if you have any pain when I palpate in any of your on your abdomen. Okay. Okay, and then I'm going to do a little palpation. I'm going to put my right hand right by your, on the right side by where your liver would be, and then my other hand at your hip. Okay. All right, and there was no pain or tenderness with that? Okay, and so I could not palpate your liver, which is a normal finding. If I was able to feel your liver, that could mean that you had an enlarged liver. So that is all good. Okay, and then everything on your abdomen looks good. I did want to go over one other thing, Mr. Sunshine, and I just wanted to make sure that you were doing an exam of your testes every month, a self-exam. And the best thing to do is to do that in the shower, and you'll kind of use a rolling method on your testicles to make sure that they're soft and movable, and that you don't have any tenderness, and that there's no hard masses. So again, it should be absent of any pain or tenderness, and you should be able to notice that they're normal, soft, and movable. And if you do that every month, then at least once a month, then you would notice if there was something abnormal happening. So maybe on the first of every month you go ahead and do that, just so that you would recognize pretty early on if you did have any abnormalities with your testicles. So any questions with that? No, okay, so I'll go over the findings really quick with you on your exam. So it looks like your abdomen is symmetrical. I do see that your skin is in good conditions. It's intact. There's no discolorations, no bruising. I do see that the contour of your abdomen is flat. I don't see any evidence that you have any hernias or abnormal pulses that I could see, which would be an indicator of something abnormal. I don't see anything like that. I was able to listen to all of your bowel sounds. I don't hear any obstruction. You have no complaints of constipation. So all the bowel sounds were evident in the 4 quadrants. Your pulses were all heard without bruit. So that's all really good. You had no pain in your bowels when I percussed them. I was able to hear timpani. And so no tenderness with the palpation. Your liver does not seem to be enlarged. And that you had no pain at your liver, and you did express to me that you were comfortable with doing a monthly testicular exam. So it looks like a completely normal exam today. And did you have any questions? No? Perfect. Okay. So if you had any reason to follow up with this, please go ahead and do that. I will go ahead and let you get dressed, and then we will see you back in the office if you have any questions or concerns. Okay, thank you so much. Take care.